We'd just like to ask very quickly if you could confirm that you can hear me just by raising your hand online to ensure there are no issues there, and that you can also see the screen. Okay, great. So we're going to officially begin now. So once again, good day, colleagues and CADRIM friends. Happy New Year to each of you, and thank you for joining our first webinar on knowledge, attitudes, and practices, more commonly referred to as KAP. My name is Reynette Royer-Thomas, and I'm the coordinator of the Red Cross Caribbean Disaster Risk Management Reference Center, also known as CADRIM. I'm joined by Erin Law, who is our feature presenter for today's webinar. Erin is the Global Zika Adviser for IFRC, based in Panama at the Americas Regional Office. Erin is a nurse and midwife with a master's in public health. She has been working with the IFRC for the last 5.5 years in Southern Africa, Geneva, and in support of the Caribbean, and in this time has supported National Society to design and complete KAP and household surveys for health, WASH, and disaster response projects using Open Data Kit, Magpie, Aquaflow, and Kobo. She is most interested in how we can make data useful for national societies, as they are the ones that will use it. Please indulge me just a little bit to share a little bit about CADRIM as the host for the webinar series. So CADRIM is a tool of the IFRC Secretariat and was developed at the request of the Caribbean Disaster Management Network, which represents the region's Red Cross national societies and works to promote effective disaster management in the Caribbean. We've been operational since late 2010 and are one of 13 reference centers across the globe, and the only one specifically designed to serve the needs of the Caribbean and based in the sub-region. In summary, we develop tools and methodologies specific to the needs of the Caribbean, capture best practices, manage the trainers database, deliver high-quality trainings, and act as a knowledge hub for the Caribbean. The Caribbean Reference Center is part of the IFRC's Policy, Strategy, and Knowledge Unit, managed through the Americas Regional Office in Panama, where Erin is based, and coordinates its work with the Country Cluster Support Team in Port of Spain, technical teams in Panama and beyond through multiple projects. So this KAP webinar series is being launched today as a concerted effort to support our national societies, as well as implementing partners understand the KAP process, but also to provide a forum where questions can be posed and responded to. We're confident that this will assist our collective teams implement appropriate interventions in the various projects in 2019 and beyond. I'm just going to pause a moment and ask if you can please mute your microphone if you are not speaking. Thank you. Hola, por favor, can you please mute your microphone, please? Thank you. Gracias, Erin.
Thank you.
Thanks.
I think I've muted everyone.
Okay. Thank you. Perfect. Thank you. Okay, so on this slide with the outline of the series, just to kind of to share what it is we hope to cover over this period. So the webinar series is expected to run over approximately a 6-week period, as you can see from the dates. And each webinar is designed to cover a topic specific to the logical sequencing of how, let's call it a KAP roadmap, could or should be implemented. So as you can see, beyond the KAP webinar for today, which is focused on the basics of what is a KAP, KP survey. We're going to be looking on the 17th of January on planning for success. So this would be particularly useful for the national societies who are going to be responsible for briefing their volunteers, ensuring that they have some of the basic adequate resources in place as they commence the planning in the first quarter of this year. On the 5th of February, we're going to be looking at the actual instruments, the questionnaire, and just to recognize the inputs from the Canadian Red Cross and Nature Conservancy, some of our national societies and technical personnel in the regional office in Panama, as well as Trinidad, who have collectively, and is still an ongoing process, providing inputs to the survey instrument that will be applied across some of the projects and tailoring it based on the needs of some of the projects as well. So that will be the focus of that webinar, looking at the actual instruments. On the 7th of February, we'll be looking at the sampling process, looking at sampling size, addressing what is necessary and not necessary. On the 12th of February, we'll be looking at the mobile data collection tools, so ODK, as we say, open data kits, but also complementary tools such as COBO. And to that is the visualization of the data. Results of the KAP surveys. And then finally, is the results and do the reports. The idea is that following the conclusion of the webinar series, we will be able to share all of the supporting documentation that will be available for download on www.cadrim.org, in addition to being formally shared with those of you on the call, those of you that have been invited and have key roles in the various projects in the Caribbean that will be using and applying KAP in this first quarter and first half of this year. So the dates and the times that the dates just referenced should not change unless the availability of presenters and other unforeseen events. Okay. So next, if we jump into the next slide, let's look at the specific objectives of today's webinar. And before I continue, I know we've been muting a few colleagues, but may I ask the colleagues in the Dominican Republic to please mute their microphone. Arnaldo, por favor. We can hear you. So if you can please mute yourself. We're having difficulty muting you, I think. Yeah. Okay, so the objectives of today's session. Today we hope to first understand the background and the history of KAP in Red Cross National Societies in the Caribbean. We're going to look and define piece by piece what a KAP survey is. And quite importantly, we're going to be looking at the difference between a KAP and a household survey. We're going to be understanding why using KAPs is important. Also to see the potential of how KAP can be used to improve our work, addressing the limitations of KAP, also to conceptualize what type of information and data we can get from knowledge, attitudes, and practice questions. And finally, to provide a roadmap for a successful KAP survey implementation. As highlighted here in red, we know that you'll have questions, which is great. Please take note of them, and we'll address them at the end of the session. So we'll reserve a few moments to be able to review those questions, and we can do them verbally, or if you prefer, you can write them in the chat box to everyone, and we will address those in the last 15 minutes or so of the time allocated. Okay, next, I'd just like to share with you a little bit quickly in terms of what has been happening in the Caribbean thus far as it relates to what we know as CAP. So if we move on to the next slide. Since 2011, in the Caribbean, there has been an incredible investment in conducting surveys in communities in particular. Before that time, but in particular in 2011, there was a regional approach to try to understand or to take stock of what was happening in communities at the household level as it relates to disaster preparedness. However, it wasn't really until 2012 when we sought to amend the questionnaires and reshape the instrument that we were using to better address a CAP approach. And coming up, we'll be looking at what the differences are between a CAP process and a household survey processes. So in 2012, through funding from the Department for International Development, there was an opportunity to develop CAP surveys specific to climate change, as well as community-based health and first aid. And those were conducted in Jamaica, Suriname, and Antigua, and Barbuda. And based on that, we were able to address what the additional needs were as it relates to new considerations regarding sampling, needs related to the visualization of data, the analysis support required for those surveys, beyond the incredible work that we were doing related to community disaster preparedness interventions in all 13 Caribbean national societies in the region. Fast forward to 2016, we were fortunate to receive funding through a Zika Preparedness and Prevention Response Project, where first we would have conducted CAP surveys in 11 countries, now 13, and really tried to perfect or enhance the CAP approach in the Caribbean. And the a lot of lessons there. So we've been taking stock of those lessons to see how we can better support national societies, not only with how the information is collected, because we've moved from 2011, 2012 to 2015 using paper-based approaches, to in 2016 using mobile data collection techniques. Also really encouraging more frequent trainings of volunteers and trying to innovate the approach that we have with supporting national societies to ensure that we can do more at scale and at quality. So yeah, there have been a number of different survey instruments. We've taken those lessons and ultimately are compiling a lot of that evidence to be able to develop what will be a new and enhanced process in 2019. At this point, I'm going to hand over to Erin, who will take us through some of the specifics of breaking down what CAP actually means, and also comparing the differences between household surveys and the CAP approach, and walking us through the ideal roadmap, so to speak, of how we can move forward. Erin?
Thanks, Reynette. I just want to check that you can hear me all right there.
Can you pull up a little bit the volume, because I hear you but very, very low.
I'm at maximum volume, so I've just moved the mic almost into my mouth. Is that improved? I hope.
It improved. Thank you.
Fantastic. So first of all, I'll just briefly talk about what is a CAP survey. And it seems quite self-explanatory. We're looking at knowledge, attitudes, and practices. And we're using a questionnaire that would examine a population's knowledge and attitudes and practices on a specific theme or topic. So what we normally do is we try and collect representative data from a specific population. So sometimes we take a target population and get a smaller sample, or we do a whole community, or we just do a representative sample of communities in a certain country. And we want to know what is known in that community, what is believed, and what is done in relation to an issue relevant to community resilience. And I'm using the term community resilience here because we often look at the threats So a CAP survey is often themed around a certain threat, whether that be a health threat like dengue or Zika, or whether it be a disaster threat or a threat like climate change. So when we talk about CAP surveys, sometimes we mix up what we mean between a household survey and a CAP survey. So a household survey is any survey at all that is collected at the household level. And because it can be any survey at all, it means it can collect a broad amount of household level data. So it's not just knowledge, attitudes and practices, and not necessarily knowledge, attitudes and practices. So it can include things like household resources. For example, do you have piped water to your home? Or it can include the impacts of a disaster. If there's been a hurricane, what has that impact been on your home? It can include information on diseases like a demographic health survey, where someone may ask, have you got a child under 5 that has had diarrhea in the last 2 weeks? And it can include knowledge, attitudes and practices. But when we talk about CAP surveys alone, we're speaking that more specific type of information. And we're looking to make that information inform our approaches to behaviour change. So we normally look at CAP surveys at a household level, so as a household survey, but we can also do them for other target groups. For example, we could do a CAP survey in a school or in a marketplace or online or with a specific group of people, like a group of pregnant women. So it's important to understand this distinction, because when you're doing a household survey, sometimes if you say that you're doing a CAP survey, people have an impression of how you might be able to use that data that you probably won't be able to use it for. So why do we use CAP surveys? Typically, the way that we have used CAP surveys in the Red Cross is to measure impact. So we're looking at CAP surveys being done at... Hello, I think there's someone speaking. If you could mute your microphone. Thank you. We start with a CAP survey at the baseline, at the beginning of a project, and then we wait to the end of the project to do another CAP survey, because we're trying to measure the impact of our project. While that can be a very useful way to use CAP surveys, what it does is it creates a bit of a tick box effect. So we say, well, we've done the CAP survey now, and we're just going to wait to the end and see if we've had an impact. To me, this isn't a good enough use of this type of data, because one of the main uses of a CAP survey is that we're using it as a way to listen and improve action. So we use it as a community engagement tool, a way to go out into our communities and understand the best ways to work with them. Therefore, we can use that in the immediate term, right now, to make a change in how effective we are in our programming. So here are some examples of how we could use a CAP survey in the immediate term, so not just a before and after. We can use a CAP survey to figure out the entry points to working with the community. For example, if a community doesn't know at all about a disease, you wouldn't go in there and start telling them what to do about the disease. You would begin by explaining what it was. But if they already knew about it, then you would start at a different point of, okay, now let's talk about what the risks are or what the actions are. We can also use it to look at gaps between what people know and what they do. So in reality, some things that we know are good things to do are not necessarily the things that we actually do. And we have to explore why there's gaps between those things. For example, I know that before a hurricane, I should get certain materials in my house ready. I should have an emergency plan and a radio with batteries. And sometimes I don't do that for whatever reason. And knowing that there's a gap there is important to how we approach the community. We can use it to understand people's motivation for action. So sometimes we assume that people engage in certain actions because of the reasons that we think they're important. For example, I think that someone would use a condom because they don't want to get HIV, but maybe their reason that they would use a condom is to prevent pregnancy. And understanding why people are motivated to do something, we can change our risk communication approach to be in line with their motivation. We can also pick up misconceptions and confusion. So if someone tells us that they think that they can't access a shelter, or that they believe that climate change is caused by refrigerators, we can then pick that up and say, how can we change the way that we message to a community to clear up that confusion? We also use CAP to look at stigma and discrimination, and some of our attitudes questions are often about stigma and discrimination. Which groups of people are probably less likely to be able to access the services that we might offer, or that may be seen as less than or as a risk group unfairly? We also look at the protective actions already being taken. So people in communities are not just sitting there not doing anything about the risks and the threats that they face. They're often already doing things, and we can utilize the things that they're doing to improve and build upon rather than starting from scratch. And lastly, we also use CAP to figure out ways to reach people. So we figure out how can we tell this community about what we're trying to tell them. Should we use the radio? Should we use the TV? Should we go door knocking? There are definitely limitations of CAP surveys. So one of the biggest is that it only records what people are willing to say. If someone comes to my house, a stranger, even if they're wearing a Red Cross shirt, and asks me a very personal question, chances are I might not tell them the truth. When we're designing questionnaires, we have to take this into consideration. People are only telling us what they can report to us. Another example is a type of question that is a Red Cross volunteer in a Red Cross shirt with a nice big smile on their face asking someone if they think the Red Cross has done a good job. This is probably a good example of why you might get some incorrect data back. Something that we have to remember is that CAP surveys are not the be-all and end-all of data collection, and there are many different ways to get information from the community. So for many projects, a CAP survey might be a starting point, and then if you want to explore certain issues in more depth, you can use other types of community engagement assessment techniques, like focus group discussions or in-depth interviews. And this is particularly important if you're going to look at certain subsets of the population. So I'm going to go into some of the information that we can get out of the K, the A, and the P sections of a CAP. But of course, in the third session, when we're talking about questionnaires, we'll go into more depth about how we design questions. So under knowledge, the very basic thing that you often need to know is, are they even aware of the topic of your CAP survey? So if you're going in to ask people about climate change, generally one of the first questions is the person even aware of climate change? Do they know what it is, or how do they conceptualize it? If you're going in to ask about HIV, do you know what HIV is? In the example of Zika, some people didn't know what Zika was at all. So before you start the questionnaire, you kind of have to ask them, do they even know what you're about to start asking them questions on? You can also find out from people whether they understand risk factors. So which groups in particular are at risk for a storm surge? Or which groups in particular are at risk of a certain disease? Or what types of things put someone at risk? This helps you understand whether people know what the risk is that is caused by the threat. The next thing you could find out is about complications or impact. So after the threat has occurred, what is the result of that? For diseases, for example, with Zika, we asked people not only what caused Zika, how it was transmitted, but then also what were the repercussions of a pregnant woman getting Zika? What did they think would happen because of that? As a result of flooding in your community, what is the normal impact that happens? And we can also ask people if they are aware of protective actions. And often we're asking them if they know how to prevent something. So before, when I talked about the difference between knowing and doing, this is where that comes in. So I may know that it's very important for me to pick up trash from my yard so mosquitoes don't collect in it, but that doesn't mean that that's something that I do. So this is where we find out if people know how to prevent or protect themselves or respond appropriately to a certain threat. For attitudes, this is where we can start asking about risk perception. So they may know what the risk factors are, but they may not think that they or their family are at risk. So for example, you may think that that some other group is at risk of HIV, but not see that you yourself have a risk of HIV. And understanding whether the community thinks they are a risk will help us to understand how motivated they might be to make some behavior changes in their lives. If they perceive no risk from climate change, how are we going to get them to engage in behaviors that mitigate the effects of climate change? So we look at what is the risk that they perceive for themselves or their families. We also look at concerns and beliefs. This is another thing that is linked to motivation. So what are the main concerns that you have around a hurricane hitting your community? Is it loss of income, loss of property, loss of life? What are the main things that would motivate you to take action? We also talk about attitude to action. So we want to understand if someone took an action, what people would think about that. So would you engage in this activity? Is this something that you would be a part of? And lastly, and I've spoken about it a little bit, stigma and discrimination. And often those types of questions are framed as, do you agree or disagree with this statement? And we often put a lot of our gender-related questions in this section. So do you agree that it is okay for a husband to beat his wife if she doesn't do what she is instructed to do? And we get a mixture of agree and disagree to find out how people perceive things like stigma and discrimination. For practices, we have to bear in mind that major limitation of CAP, we are not observing them do these things. We are actually just asking them if they do these things. But we can divide these types of questions into three main areas: what people do to protect themselves as an individual, what they do to protect their household or family, and what they do to protect their community. So when we look at the actions in behavior change models that people take, there is what you do for yourself, there's what you do that is influenced by interpersonal relations in your household and your family, and what's happening in a community. So when we ask a question about protecting yourself, we could ask a question like, what kind of things do you do to protect yourself from mosquitoes? And people might say, I use repellent, or I sleep under a mosquito net. For protecting a household or family, you can ask them what they do to protect their household and family, and they may say, I clean my yard, I screen my house. For protecting community, people may say that they participate in cleanups, they go to community meetings. So there's different levels of people's involvement. Then we can also look at people's participation. And for specific projects, we may be wanting to ask, are people involved in local government meetings where they talk about climate change, for example? Or have they been involved in a community cleanup? And lastly, we would look at post-impact response. So this is after something has happened, after the impact of the threat, what are they doing? And for me, the easiest example to give, because I work in health, is if you get sick, what do you do? Do you go to the doctor? Do you go and treat yourself at home? Do you go to a witch doctor? Do you go to a religious leader? What is the thing that you do immediately after you've been impacted by a threat? And the last thing that I mentioned that we collect information on in CAP, and we do this even though it doesn't fall under K, A, or P, but it's about the information sources people use. Because whatever we get back, we need to figure out how we're going to do risk communication in communities. So we find out what sources people already use. Are they using radios? Are they using TV? Are they using social media? Are they using Facebook? And then we have to find out what people trust. So people may be using Facebook to get information, but they may also not trust it at all. So we have to figure out who are the key people that we may need to inform to give that information to the community. And also we have to find out what is important to them. For example, if a disaster is coming, what is the information that people actually want to know? Because they may not care anymore about learning how to prepare their household kit. They may want to find it more important to figure out where the shelter is, or evacuation routes, or where they can get medical care. So I've put together a very brief and very basic KAP survey roadmap of what to do before, during, and after. And all of these things we're going to talk about within the series itself. And much of it we can be preparing or planning for a success session, which is next. But before the KAP, the most important thing that anyone can do is define your purpose. And it seems incredibly basic, but it is something that we don't do. The purpose of the KAP is very different from the purpose of the project. You have to work out how you're going to use the data. And I would highly recommend figuring that out beyond before and after, so baseline and end line. How are you going to use the data immediately? You have to develop the survey, inform the community of what you're doing. You prepare with different maps, and we'll go into that when we look at sampling. You have to do sampling, train your volunteers, and you have to pre-test the survey. An untold number of things go wrong if you do not test the survey, and you can't test it in an office environment because all of the things that can go wrong won't go wrong in your office. Then during, you're doing field sampling in the field as well, and the implementation. So there's a lot of logistics involved in that, and figuring out how many days you want to go for, how many volunteers you will need for that, and asking your volunteers what is practical. And then after the KAP survey, we're doing the uploading of the data. So we'll talk about how we can use ODK and COBO in particular. We have to clean the data, do visualization, so have a look at the data in pie charts, or have a look at it in bar graphs, and then do the analysis, because the visualization and the analysis are two separate things. And then we have to make an action plan. So doing a nice data analysis and report does not equal the end of the KAP survey. Then we can look at sharing that back with the community, because it's data that we've gotten from them, and so they deserve the information back, and sharing with other stakeholders. So what often happens when you think about KAP surveys is we get through the before and the during, and we've forgotten to think about the after. So I would encourage you throughout listening to these webinars to constantly be thinking about the after. So now is time for questions, and I think Reynette has actually been looking at them and checking if I have any questions, because I can't see the question line. But also I have my email down in the corner there. If any of you have any questions about KAP surveys, please feel free to ask. And I'll be happy to providing your email to contact them.
Hello, can you hear me?
Yes, I can hear you.
Yes, I raised my hand, but since I saw no response, I decided to unmute myself. Hi, this is Catherine from TNC with Dominican Republic, sorry. So, thinking about the after of the KAP, what happens when you do a baseline KAP and then need to do a follow-up to see if attitudes and practices have changed after intervention? In terms of sampling and sample selection, what are the strategies, considering that there might be communities of different sizes?
Yeah, so we'll go into that in a bit more detail in the sampling week. We're going to talk about two different types of sampling. that is a cluster randomized sampling, and something called LQAS sampling, so that you can see the differences in how you might be able to make changes between a before and an after. So, for example, you may need, if you're comparing different groups, a larger sample size than if you're just comparing before and after. And depending on the size of the community, you would have to get slightly different sample sizes. But we'll definitely go into more detail with that with our experts in it from PMER in the sampling session. I also see a question here from Juliana Bravo. It says, it may be covered later, but I'm wondering about your comment on the cap of the data collection unit. It means that the household is, what is the unit of analysis? Individuals, I assume, correct. Maybe to look into sampling at a later point, but how do we address selection bias? I think that's a very good point, and I guess, again, it will be covered in more detail in the sampling session. Orlando, if you can mute yourself, that would be great.
I beg your pardon?
I think you're unmuted. Someone has requested for people who are unmuted to mute themselves. Thank you. And so when we do CAP at a school level, often we're looking at the individual data, and even at a household level, often the instructions to the volunteers will be to speak to the head of a household, and we're getting individual level data. So because in a CAP you're asking people about their opinions, we can't necessarily generalize to a whole household that that's their opinion, but we can collect household data. So it just depends on how you structure both the questions and the instructions to the volunteers. I don't think I'm seeing any more questions unless I'm just very bad at using this WebEx tool.
Erin, this is Gwen. Hello. I just have another question, if that's okay.
Sure.
So I'm just wondering, if something emerges during the first round of CAPs that was unexpected, is there any way, I mean, I'm guessing you don't want to modify the CAP too much for the second round at the end, but is there any way you can incorporate that sort of data that you hadn't planned to collect, perhaps if it's relevant to the project still?
Yeah, we had some experience with the Zika project. So the first thing that I'll say is that you have to pre-test the survey. And I know I said it in the presentation, but often the things that pop up when you're carrying out the survey aren't things that would have been picked up in a pre-test, and you can fix the question so you're getting the right data then. But the other thing that you find is as you go through a community, you start finding out other bits of information and wishing that you could ask more questions about it. And in particular, this happens with rumors. So we started hearing in response to questions that had a set number of multiple choices, additional answers that were filed in other that were actually rumors related to Zika. So we then went on to use another type of tool to collect rumor information. So we basically explored more, and that's what I mean when I say CAP isn't the be-all and end-all of data collection. We have to look at, okay, let's explore this more in a focus group discussion with a certain group, or let's go and make a tool to collect other types of data, or let's do some key informant interviews.
Great, thank you.
I see another question from Juliana. Are there estimates or benchmarks on the cost of implementation? So in my experience, this varies wildly from country to country. In the RAMP manual, which is available on the Federation's website, so RAMP, Rapid Result Assessment. They did some cost estimates in 3 or 4 countries, but it really depends on the country. And as we go through, and I think in preparing for success, we should be examples of the cost estimates, and we can pull them. Certainly, we can pull them from the project of when you train volunteers and when you go out into the community. But the type of sampling you use will definitely affect the cost, because if you are going into multiple communities, suddenly the cost is a lot higher because you're logistically just having to do more. But we'll try and collect those benchmarks. That's a really good point. Marissa is asking, is CAP a survey or a process? So when we talk about CAP surveys, we're talking about that it's just a survey. When we talk about this CAP survey webinar series, we're talking about the process of what it means to actually implement a CAP and be able to use that data. So you can have a standalone CAP survey and then not use it, but what we want to do is explain what is a CAP, how it can be used, how to create the survey, how to then use that data, and then how to basically make sure that a CAP survey is something that is not just a tick box exercise. Thanks, Marissa.
Hi, Erin. Can you hear me now? Can everyone hear me?
Yes, I can hear you right now.
Oh, wonderful. That was hard for me for about 7 minutes because something went wrong on this end. So thanks again. And there were a couple of other questions. We had a question from St. Vincent of the Grenadines Red Cross, and they were asking regarding the consolidation of the webinars because they're run over 6 or so weeks. And so the question was whether or not it would be possible to basically explore another modality to consolidate the webinars to a shorter time frame so that implementation in the countries could be expedited further. And so my response, and just to share with the group, is that at this time we have tried to consolidate as much as we can in the sequencing, and also in the absence, for some countries, there's not the ability to provide direct face-to-face training in some of the countries this month. The idea is to be able to break down each step of the process to be able to respond to the training needs and to ensure that the concepts could be grasped further. But if we're able to shorten the time frame, we certainly will, because we understand the urgency for some of the projects, noting that most are commencing CAP surveys in March of this year.
I just have to add that we're also completely in line with this webinar series. We are editing and upgrading a CAP guide for the Caribbean that lays out all parts of this process with the different sampling options, with how to construct questions, with how to use data, with the preparing for success, that we're really pushing to get ready for in advance of the end of the webinar series at least.
Yeah, that's right. And so the idea is that the documentation will be available for download on the CADRIM website, but also following the webinars, once the document is presented, then it would be shared as well via email. Okay, so Camilla's mentioning that we're breaking up a little bit. Also to mention, there's another question from Jamaica Red Cross regarding the availability of the recordings. And so just to confirm that the recordings traditionally will be sent almost immediately following the webinar, but today we're supported by our colleagues in Geneva, and so we may not be able to send the recording for this particular webinar until Monday, but if we can, we will certainly send it by close of business today. Any other questions from the team? I must say, sometimes you're a bit unusually quiet, but but if there are no other questions, we won't keep you much longer. We're ending at the planned scheduled time to conclude this particular webinar. I'd like to take this opportunity again to thank Erin, who has led this process for the first webinar and will be supporting us throughout the webinar series. And you can contact her directly if you have any questions, as well as the team based in Barbados regarding the CAP process.
Thank you very much, Reynette.
So
thank you,
if there are no
everyone.
other questions, thank you, Erin. Thanks, everyone. So we'll be in touch following the end of this call. Take care.
Thank you, Reynette. Thank you, Erin, and everybody.
Thank you.
Thanks. Okay.
Thank you.
Thank you.
Four, three, three. No, 434 65 40.